Hello everyone, I'm Jordan, and my presentation is on ulnar collateral ligament sprains of the thumb. Alright, so what we're going to cover in this presentation, we're going to define what exactly a UCL sprain of the thumb is. We're going to discuss the pathomechanics, describe the signs and symptoms associated with it, as well as the functional limitations, identify different appropriate tests and measures that can be used, discuss differential diagnosis of UCL sprain of the thumb, then review the rehab process and protocols, and then discuss the expected outcomes. So what is a UCL sprain of the thumb? So first, the UCL is located at the base of the thumb at the MCP joint, and it connects the head of the first metacarpal to the proximal phalanx of the thumb. And so a sprain of this is essentially just a tear of the UCL, and the tear can be either partial or complete, and it will sometimes be known as skier's thumb, gamekeeper's thumb, or breakdancer's thumb, and I'm going to explain kind of why in just a second. And this specific pathology affects the stability of the thumb, especially under different valgus or lateral stresses. And so this sprain is graded based off the severity of the injury. So you have grade 1, a grade 2, or a grade 3. And a grade 1 involves mild stretching without tearing. Grade 2 is a partial tear with some instability. And a grade 3 is a complete tear, which results in significant instability and will often require surgery. What causes a UCL sprain of the thumb? So typically, you may see it occur after traumatic injury, and so that's where the term skier's thumb comes into play, because this condition has a high incidence in skiing accidents where an individual falls and catches the thumb on their ski pole. And in this situation, the thumb is forced away from the hand in an unnatural direction, which can cause the UCL to tear. And so you may see it be forced into hyperextension or hyperabduction. And then the term gamekeeper's thumb applies to the chronic overuse aspect of it. And this is just due to the occurrence in individuals who are repetitively stressing the thumb. And so these chronic overuse cases typically involve just repeated stress through activities that consist of gripping or pinching motions, such as specific manual labor or certain sports. So the clinical manifestations of this condition. So with a UCL sprain of the thumb, you may notice swelling around the MCP joint due to inflammation, as well as bruising at the base of the thumb, which may extend into the palm. In severe cases, you may notice a palpable gap, which can be felt at the UCL, indicating a complete tear. And so this would just be the visible deformity. And then obviously it will cause a lot of joint instability at the MCP joint. And then the symptoms experienced by patients who have this pathology include a sharp pain at the site of injury, particularly during thumb movements or pinching activities. And this area will also be tender to the touch, and patients may experience weakness in grip strength, resulting in difficulty holding objects. And over time, the thumb may become excessively stiff. And this is especially if the injury is not properly managed. So for the functional limitations that you may see, so this would include difficulty performing specific tasks that require fine motor skills. So this could be certain things like riding or buttoning a shirt. And you may also see weakened grip strength, as we talked about before, which just reduces the ability to grasp and manage objects. And then as well, you may see just limited range of motion of the thumb. So test and measures. So range of motion may help reveal limited extension of the thumb, particularly at the MCP joint, which can indicate the extent of the injury. And then manual muscle testing is often used to assess strength in the thumb's muscles, such as the flexor pollicis brevis and abductor pollicis, which may be compromised due to the injury. And then you have specific imaging such as MRI or X-rays that can help identify if this is the condition. And then you have special tests like the UCL stress test, which just involves applying a valgus stress to the MCP joint. And if you notice any increased laxity compared to the contralateral thumb, this could indicate ligament damage. And then the pinch test helps evaluate functional instability during thumb to finger pinching, which can be indicative of UCL sprain. So differential diagnosis. So first we have a Stenar lesion, which is where a torn UCL becomes trapped above the adductor aponeurosis, which can prevent the healing of this injury and sometimes require surgical intervention. And patients with a stenar lesion often present with persistent pain and swelling despite having treatment, and it typically requires imaging to rule this condition out. And then we have de Quervain's tenosynovitis, which involves inflammation of the tendons and thumb's extensor compartment, and it can be differentiated from UCL sprains by specific clinical tests such as the Finkelstein test, which we've all done and talked about before, which induces pain over the radial side of the wrist. And so in this one, you have the patient make a fist, the PT will grasp the patient's forearm to stabilize and their fist, and then passively ulnarly deviate their wrist. And this, you're just looking for any pain that may occur over the abductor pollicis longus or the extensor pollicis brevis tendons. So the rehab process and the protocols for this. So most importantly, early management and treatment is very important for recovering from a UCL sprain of the thumb, and the treatment can vary depending on the grade of the sprain. So in the maximal protection phase, immobilization in a thumb spica splint or a cast is usually crucial to allow the ligament to heal. And during this period, there are certain edema controlling techniques such as icing, compression, and elevation that are recommended to help manage the swelling, as well as gentle range of motion exercises that can be introduced to the adjacent joints just to help prevent stiffness. And then in the moderate protection phase, this focuses more on gradually reintroducing more range of motion to the thumb. And this is just to ensure that exercises are performed within a pain-free range. And then we also introduce certain strengthening exercises which will target the thumb muscles to begin during this phase to restore function. And then in the minimal protection phase, this is where we'll introduce full range of motion exercises aimed to restore complete thumb mobility, as well as functional strengthening exercises which are introduced to produce or to improve grip strength and dexterity. And patients are slowly reintroduced to activities that involve gripping and pinching. This phase is also critical for ensuring that patients can safely return to sports or other demanding activities without re-injury, so specific jobs that they may have. So the likely outcomes for this condition. So the prognosis for a UCL sprain of the thumb depends on the severity of the injury. Most non-surgical cases, such as grade 1s and grade 2 sprains, typically heal within 6 to 12 weeks with proper rehab and treatment. Conservative treatment usually results in a return to full function. And so for complete tears or cases with associated stenar lesions, surgical repair may often be required. And this can include a UCL reconstruction or repair. And then with this, recovery may take 3 to 4 months post-surgery. But with a well-structured rehab program, most patients regain full thumb stability and strength. And the outcomes are just generally favorable with adherence to rehab and treatment. And for athletes, they'll typically be able to return to sports within 3 to 4 months. So the overview for this presentation: a UCL sprain of the thumb occurs at the MCP joint. And this condition is commonly due to specific trauma or chronic overuse syndrome. And it's known sometimes as skier's thumb, gamekeeper's thumb, or breakdancer's thumb. And for the trauma, it's typically where the thumb is forced into hyperextension or hyperabduction. The clinical signs include swelling, bruising, thumb joint instability with symptoms that involve pain, tenderness, weak grip, and limited movement of the thumb. Diagnosis involves performing range of motion, specific manual muscle testing, and special tests, as well as certain imaging. And then common differential diagnosis can include stenar lesions and de Quervain syndrome. And then the rehab protocols can help reduce pain and increase function, which will ultimately allow the individual to return to their normal function before they experience the injury. And these are my references that I used.